Just a quick, have any of you filed any thing on what meaningful use is? Okay. That's an interesting point that is brought up about the chairlady's father. And I want to ask Dr. Cressley this. If someone, and I know you're a pediatrician, but let's say that somebody come in that's from another state and we have this up and running, and there was a problem with getting the information off, and I'm just, or maybe they can't locate a different system or whatever. They're trying to compile all this information, and it takes a while to do it. And this person's in the emergency room, and they need immediate care, and that care is given to them or whatever. An hour later, all these records come in, and they find out that they did something totally wrong, but they had to do a quick assessment of what was going on. You know, I think it's hard for everybody to get their head around this and what all is going to be involved to get these records down to something that they can actually be very beneficial for the use. Mr. Fetzner there was talking about it's going to start in a home. It's going to eventually get down to the home, you know, of somebody being monitored there. So what are the complications that could arise from these medical records, and what kind of care a doctor may be hesitant to give without these records, him having these records? If the system was in place. I know now he basically just has to work from what test he can do immediately in that. But if these records were available, how hesitant would a doctor be to go in and try to do something acute care without these records?
It's an interesting question. I believe, first of all, that physicians always act with whatever information they have in front of them at the time. I don't think that the electronic record makes any difference than the paper record. In my experience, if you're in the emergency room and someone comes in and you call for their old records, they come up a half an hour later.
But this is somebody that doesn't have any old records,
or has none. But that's But that you're at a disadvantage even in your own hospital if somebody's looking for the paper record that's 40 feet deep. I'm hoping that physicians will not alter the way they think in that providing care with the best information they have at hand. The other thing that everyone should be aware of is that we talk a lot about interoperability and exchange of information. There are actually some pretty good basic standards written already that the leading vendors are starting to implement. And physicians really don't want everything. I mean, I don't have time, whether it's on paper or in an electronic record, to sift through a lot of data. There are a couple of hot ticket items, problem list, current medications, history of surgeries, things that don't really take a sophisticated amount of data exchange that would affect how we treat medicine and medically. And I'm not so sure that you do that any different electronically than you do with a phone call to the physician who might have seen them before, or whether the patient brings a thumb drive with their personal medical records and we can get it that way.
Okay, so now let me ask you another question. So now you're the doctor, you've got the medical records, and I don't know how long it's going to take you to go through them. Do you depend on what you observe or what the medical records and what some other physicians have said about the conditions that the patient may have?
You do it multifactorially. You take every information in consideration and you act as quickly as you need to be based on the information that you have in hand. And sometimes you look back and you alter what you've already done, and there's things that were probably not implicated. But we have a better chance with the hot ticket mistake items as far as medication interactions, medication allergies, big problem list. If we can condense them and get them quickly electronically, I really do believe that that has the potential to save care, and physicians would act in the patient's best interest with more data than we have now.
Thank you. Dr. Edwards, given your unique perspective on the state level and also being a small business provider level, what do you see the proper role of the federal government versus the state being in this care for our citizens?
I see the role of the federal government as being one that knocks down barriers or tries to create opportunities that would allow state government as well as local practitioners to then implement and advance the adoption and utilization of EHR. We typically say healthcare is local. Most people do receive health care in their community by their local provider. And so that individual as well as that community should be able to make decisions about what's in its best interest. The federal government, I think, has an obligation to create standards and ensure compliance, but at the same time not create barriers or inhibitors to us moving forward with systems and processes that really serve the interests of the consumers and the constituents in the community. And so I would look to the government to ensure that there are standards, to ensure that there's compliance as well as safety, and then create opportunities that will increase adoption and utilization. In Georgia, we're actually looking forward to the opportunity to participate in some of the high-tech related initiatives because we think that we'll, as a nation, get more bang for our buck if we do use a centralized system of training or technical assistance for those providers who can't afford to go out and do that on their own. So if the money is available, I think it does make sense for the state to participate to help provide training, to help provide technical assistance, as well as to ensure that the incentives that are provided actually meet the needs of those providers in their community.